Welcome to today's webinar, Getting the Information and Resources You Need for Childcare Recovery and Stabilization. As New Hampshire's childcare system and programs transition from emergency to recovery and stabilization, providers will need information and resources in order to serve children and families in a safe and healthy environment. This is part of a webinar series we provided every other week through to August 20th, 2020. I'd like to welcome you to this week's session. Please note that today's session is only an hour in length, and moving forward, all remaining webinars will be an hour in length and will pertain to general updates. Today, you'll be hearing updates from the following: Department of Health and Human Services update with Marty Ilg, Deputy Director of the Division of Economic and Housing Stability. Public health questions from providers, answers provided by Patricia Tilley, Deputy Director, Division of Health Services, reviewed by Marty. Child Care Licensing update with Melissa Clement, Chief of Child Care Licensing Unit. Bureau of Child Development and Head Start Collaboration update with Diane Chase, Assistant Bureau Chief, and Deborah Nelson. Update on Child Care Aware of New Hampshire Programming and Services with myself. And then a question and answer period will follow with Emma's assistance. So first, we'll be hearing from Deputy Director Marty Ilg from the Division of Economic Housing and Stability, and following, she will provide answers to questions for public health provided by Patricia Tilley, Deputy Director, Division of Public Health Services. Marty?
Hi, good afternoon. Waiting for my slide. There he is, my grandson. Going to flood you all with photos of him every other week. The last webinar, we talked a little bit about trying new things and how it might be uncomfortable or even a little scary at first. But after a little while, once we get our feet wet, we might be able to plop right down. Kids have an advantage over us in all of this. Their lives are so full of firsts, so many daily changes that it's normal to them. Change. So what comes to mind when you hear that word? What about the question of how to embrace change? We recently talked with a provider who just partnered with a parent co-op to complement her programming. Said to me, just so you know, I'm not a huge fan of change. I like those warm, fuzzy feelings that come from my comfort zone. But I guess this is about me handling change instead of change handling me. I recently read a blog about embracing change, and the author was a young mom. And here are her 6 tips on how to embrace change. Number 1, name past changes that you've gone through. That we've all gone through changes in our lives, but when a new one comes around, we don't always remember the past change, and that's because we adjusted already. Changes we've gone through become normal after a while. We made it through the last change, and we can do it again. 2, welcome all your feelings. They will find you anyway. Accept the struggle, grieve what was, but don't wallow in it, because that's not healthy. 3, put a spotlight on happiness. This is about finding the good. You know, there's no shame in saying this is hard, but we should, and we're allowed to have concerns, but we should try to shine a light on the upside of things and see new and good opportunities. 4, write down exactly what's changing. In your head, the change might seem massive, so take it out of your head and put it on paper. This is how I ditch the dread and cut change down to size. Change can fill our heads with fear. If we leave it there, it grows like weeds. 5, mindset is everything. Change how we talk about the situation. Change isn't always a bad thing, but it does bring up fear and anxiety. Changing our mindset is crucial. I can't do this much. Saying these things is not going to help us. So if we can tweak these phrases a little bit and say something more like, this is really hard, but we can make it. This is a lot, but we can do the best we can to handle. Number 6, plan and prepare, but always leave room for a learning curve. I think that's really important. This step makes us aware of our choices. Life is changing all of the time. Change is a process. In order to fully embrace change, you have to go through the process. Change is one of those things that's unavoidable. Life is not stagnant like water. So, you know, these are wise words from a young mom, and I certainly thought about all of hers. And I hope they will help all of me. Then we have this slide from public health. Trish can't be with us today, so I'm going to read her slides. And if we have any specific questions, I guess we will note them down and we will send them over to public health. Oh, before I start with the questions, we do have an announcement from the FDA. The FDA has released an urgent warning to consumers and healthcare providers that their hand sanitizer products that are labeled ethanol alcohol, which is a safe form for topical use, but they've tested positive for methanol contamination, which is, I guess, a wood alcohol, and it can be toxic when it's absorbed through the skin, which of course is where we put the hand sanitizer. So if you go to the FDA webpage, you'll find 75 products on a list, and all of these are potentially toxic and can be absorbed through the skin. And I think that Tracy has more information later, and I believe they also posted on their website already. So the next slide, please. Runny noses and fever. If a child has a runny nose, do we really need to exclude them just on that symptom? If a child has a fever, do they need to be excluded for 10 days? The answer to both is yes. And if the parent chooses not to have the child tested, they are to be treated as if they have COVID-19 and should follow the CDC guidelines for removal, isolation, and return. It should be treated exactly the same way as if they test positive. If they're tested and they are negative, they can be allowed back once they are fever-free after 24 hours. Why take temps? Are routine child staff temperatures still helpful since they may not catch asymptomatic individuals? Yes. Temperatures are still potentially helpful as an objective assessment of illness. We know people minimize or explain away symptoms, but it's hard to argue with the documented fever. Routine health screening may not catch everyone with COVID-19, but it is one of the many layers of prevention and early detection that childcare agencies should be using. Young children really spread COVID-19. Anyone can acquire and spread COVID-19, including young children. And the last one, what are the symptoms of COVID-19 in regard to children in our care? The symptoms may look like mild childhood illnesses and include fever or chills, cough, shortness of breath, or difficulty breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Symptoms may appear 2 to 14 days after exposure to the virus. While all children are capable of getting the virus that causes COVID-19, sometimes they do not get as sick as. Although rare, children under 1 may be at high risk of severe illness from COVID-19. All children and staff should be screened daily on arrival. Again, any additional questions, please put them in the chat and we will send them over. Thank you.
Thank you, Marty. Our next speaker is Unit Chief Melissa Clement from Child Care Licensing. Welcome, Melissa.
Welcome, everyone. Hi, everybody. Nice to sort of see you. At least it's nice to know that you guys are out there and listening, and so appreciate all the participation that we have in these calls. The main update that I want to provide right now from Child Care Licensing is now that we have the guidance for schools out there and schools are making decisions on how they are going to operate, we know there are a lot of questions about what does that mean for programs that currently have school-age children, and if their schools are going to a hybrid model or virtual model, what does that mean for their attendance? So this is one of those situations where if you have school-age children that will be in your program for more than 5 hours a day during their normal school time, meaning Monday through Friday would be their normal school time, whether they're doing a virtual or hybrid model, then you will need to ask for a waiver from us from Child Care Licensing. This is one of those situations where in our rules and statute, it says that a school-age child may be in care for up to 5 hours a day on school hours, during normal school hours. So if schools are open and operational but are choosing a hybrid model or all virtual, so they may be in your care while parents are working, or your staff's school-age children may be coming with you to work so that they can continue working in the program, we will certainly be granting waivers for those situations, but our emergency order requires that we evaluate all these situations on a case-by-case basis and issue waivers, where you can't just blanket go out there and say to everybody, don't worry about it, take all the school agers, you know, they can stay as long as they need to. We have to do it on a case-by-case basis for each program, and that is certainly something that we will be doing. So reach out to your licensing coordinator or send an email to our CCLU office at dhhs.nh.gov saying that you need a waiver to allow school-age children in your program to attend longer than 5 hours per day during the school year. Please wait until you have confirmation that that is going to be true in your situation. We know not all schools have made a decision yet on how they're going to operate, and it would certainly help us to wait until you know that that's going to be a situation in your program rather than asking for this waiver ahead of time, because we may be granting something that you will not need. We will certainly be granting it if it's something you need, but please wait, and once you have that confirmation for the families in your care, send that along to us and we will process that for you so it is on record. If you have any questions about that, again, reach out to the CCLU office at ccluoffice@dhhs.nh.gov. Thank you. And I hope everyone is doing well during this time and that you're able to get outside and enjoy some of this lovely summer weather that we're having. Maybe not so much today with the thunderstorms, but thank you, everyone. Hope everyone is well.
Thank you, Melissa, for that update. Next on the agenda is Diane Chase, Assistant Bureau Chief from the Division of Economic and Housing Stability, Bureau of Child Development, Head Start Collaboration. Welcome, Diane.
Thanks, everyone. Same sentiments shared as Melissa. I'm glad you're all out there and doing your thing. First, I just want to say thank you to everyone that applied for the CCRSP funding and your patience with us trying to get all of these documents in and fulfill the requirements that are related to this funding. We're averaging, we'll talk about that in a minute, but we're averaging a lot of emails every day, and we're working as fast as we can to get everything out. Tracy, why don't we flip to the next slide, and I can give you folks some updates on where we're at. So right now, so far we've awarded over $16 million, and we're not done yet. This is very exciting because we feel like this will help a lot of you get a level of stability for your programs, especially with income losses. In the next few days, we're going to be providing more information on how to use those funds. But currently, we have 603 programs that applied and in 418 applications. 39 of those are multi-site applications. That's why there's the discrepancy. 408 programs have already gotten their award letters. And those of you, the 10 who haven't gotten them, most likely are because of some missing financials. One of our team members should have reached out to you. If they haven't, please let us know. And we only had one program out of all the applications so far that wasn't eligible. And so that's very exciting too, given the difference of some of the other programs that have gone on across the country where people weren't eligible. Out of that 408 award letters, we've already gotten 356 provider agreements and attestations. As you know, that prompts the sending of the invoices. And I wrote this yesterday, and there was 108 invoices that had already been received and were being processed. And that's already gone up significantly today. So I just added the trivia at the bottom. On average, we're receiving between 75 and 100 emails are being addressed every day. In addition, there's calls and mails and faxes and scans. The reason I wanted to share that is, and that's not just the ECCP mailbox, that's the invoice mailbox, and that's our personal mailboxes as well. So it's well beyond 100 a day. So we are doing our best, obviously, not to overlook any email, and we're doing our best to answer them as quickly as possible. But it is also, don't hesitate. If you haven't heard from us, please email again. Don't assume that we saw it and just haven't gotten to it. In most cases, we try to get something back to you, and we don't mind a duplicate or another request. Please refer to your previous email so that we know. Just say, hey, I sent you an email on July 14th. I haven't heard back. Any update? And that'll help us track back the process. So let's flip to the next one, and let me give you some updates. So what's happening next? As I said, right now we're processing the agreements, and there's attestations, the invoices. I'm in the process of putting together, which will be on the CCR&S website on Monday, is a recorded webinar on how to complete your invoices. So far, the ones that have come in are looking really great. Remember, if at all possible, having those electronic. We are not, finance really doesn't want paper copies. That the electronic ones are the ideal, even if you have someone help you with it. And we'll also have some of the answers to some of the frequently asked questions that I've been getting. For example, is it possible to get a direct deposit? Which the answer is no, because it's a limited number of payments. One of the other top questions that you want to put sort of in your back pocket is, no, you don't have to invoice for all of the funds. If you decide that after you go through the next July 30th recorded webinar, which is understanding what the allowable expenses are and how to document them. And if you, for some reason, feel, I don't have enough things to apply all those funds to, you don't have to accept all the funds. Excuse me. So, and we will be keeping track of the questions and frequently be updating the answers to those. Then on the third part of it is on between July 29th and August 26th, we're going to start working on that round 2 funding reviews, which means going through each application, looking at what your funding requests were again, specifically how that relates to the funds that you've gotten, how it relates to allowable expenses, and also looking at dollar-wise what we have in our balance of funds to go to programs. Our goal is to announce those funds in early September. You do not need to reapply. So don't feel like you're, oh my gosh, now I got to do another application. No, you've done the hard part. You do need to help us understand some of the things in some of the applications, and our team members will be reaching out to you, but this isn't a heavy lift. You've already done the heavy lifting. And I think that is, unless any of my colleagues have anything they'd like to add, I think that's the gist of what we have for the CCRSP updates for right now.
Hi, everyone. It's Deborah, and thank you to all of you for joining us. We so appreciate, as my colleagues have said, that you take the time out of your busy day to be with us. And I just wanted to add to one request to Diane's presentation. If you decide definitively that you are not going to take all of the funds because A, you don't need them, B, you don't need the tax liability if you're not going to use them, then we really would appreciate if you would let us know as soon as you know that, because our goal is to make sure that if you're not going to use your funds, we can reallocate those, because we've been told by Gopher that we have to have all of these funds out the door and spent by December 30, 2020. So that's our charge, and you can help us with our charge by keeping us informed of your decisions. But wait till you know that for sure, because we would hate you to be in a position, or for you to be in a position where you thought you didn't need it and you told us and you weren't going to bill it down. And then, 2 weeks later, you thought, oh, I really could have used that. So just only if you're absolutely certain that you're not going to accept your full award do you need to inform us.
And just to add one last thing to that, please, for those of you who are going to be getting license increases, expansion, please keep us apprised of that as we go towards round 2 funding. So just send a notification of that, maybe a copy of a new license or changes that you've made to our ECCP mailbox, so that we'll have an idea of what's going on with your program. And also you can update your team person once they reach out to you as we start those round 2 funding reviews. And I know there's lots of questions in the chat box, and I will do my best to answer all of those. What don't get answered today, we'll answer as quickly as possible and get those posted. And that's all for me.
Thank you, Diane. So on behalf of our Bureau, there is one more announcement that I would like to make. So I'm sure many of you are aware that because of COVID, we had to postpone the launch or rollout of our final policy changes that are required by the 2014 CCDF reauthorization. So the final changes are paying registration fees, changing the policy for absentee payments, meaning there's much more chance that children will be able to meet their service level and you'll be able to get your full payment. And then the last thing is mental health and substance misuse, child care when for children when families are in treatment. So that rollout's going to happen on August 3rd. That it had to be changed within our system. That's happening August 3rd. And stay tuned. There's going to be lots of information coming out to you. There'll be a letter to providers, a letter to parents, and there'll also be some training, some webinars. So no worries. By the time you're ready to make any changes to billing, you'll know exactly what to do. And that's all I have. Thank you.
Thank you, Deborah. Thank you, Diane, for those updates. Now, I will be providing a brief update on services being offered through Southern New Hampshire Services, Child Care Aware of New Hampshire. The picture, if you look really, really close, you can see a little fairy house that my daughter did a couple summers ago. So those of you looking for something to do, that's an excellent activity and an excellent book by Tracy Kane. So I would encourage you to check that out. But in terms of updates, the Child Care Aware of New Hampshire team, we do have established emergency child care lines, and those have been established since the onset of COVID-19. Just a reminder that these lines are available for programs to update their program vacancies and their status. So if you're open, closed, if you've reopened, and what your vacancies are. We have found that some programs that have opened have not notified us regarding their status change. And currently we are only referring families to programs that we have been informed are open, and all open programs are displayed on our interactive map on our website. If you are not seeing your program on this map, then please call one of our emergency phone lines and let us know when you opened and how many vacancies you have, and we can put your program back on referral status. Our emergency phone lines are 603-578-1386, extension 2528, extension 2533, and extension 2531. They're also listed on our website. You can also email us this information at ccrr@snhs.org. So In addition to other updates, we continue to provide training and technical assistance. We're currently offering a virtual TA cohort on the environment rating scales. And we recently have 2 compilation videos that have been completed. The first one is called Thinking Outside the Box, and it features programs during this time exploring and reinventing their outdoor play spaces. The second will be coming out as well, and that's entitled We Can Do It. This has some really great pictures of programs and some really, I think it has some snazzy music too. So be on the lookout for that. And then staff are busy preparing our annual training calendar for the fall of 2020 to June of 2021. In addition, our program survey went out on Friday, July 17th. This survey is strictly regarding Child Care Aware of New Hampshire services through Southern New Hampshire services. Thus, we're seeking your input on your experiences with our program receiving referrals, outreach, marketing materials, our website, live chat, technical assistance, consultation, and coaching services. This survey is being done through email, through our Constant Contact program. We would encourage you to complete it as we utilize it to adapt our services and then to get your input on what we should be considering in terms of our future programming. In light of that, we're offering a unique opportunity for the first 200 programs that complete this survey. We have partnered with Sean Middleton from Storytelling with Sean. He'll be providing 2 virtual storytelling sessions via Zoom to programs that respond. Programs will be able to tune into this Zoom session at their program, and the children will be able to participate in one of these 2 virtual storytelling sessions. Due to participant space on our Zoom account, each program can access this link for 2 computers within their program. In addition, we're providing a second summer sneak peek. We had our first one last week, the week before. And if you want to get updates on what we're planning on doing so far and what we've adapted due to your feedback, I would encourage you to participate in that. The second summer sneak peek is coming up on Tuesday, August 18th, and that's in the evening, and registration is available now. And then in addition, we've been working on a new and updated website that will be coming soon in the fall. So that concludes my update. Now we're going to move on to questions and answers with Emma.
And as Emma's pulling together the questions, may I make one more announcement, Tracy, that your
Yes.
comments made me think about?
Oh, absolutely. Mhm.
So everybody, if you've not heard, part of what we're doing through the preschool development grant and just as the work on integrating Department of Education work with Department of Health and Human Service work to more better leverage our resources and working together. Deputy Commissioner Christine Brennan has asked us to get the word out as broadly as possible that they're working with a program called Waterford Upstart. It's for parents to work with their 4-year-olds on various skills and whatnot at home. There's science, there's math, and I think there are a few, there might be some literacy opportunities too. And so we said we would get the word out, and what happens is all parents of 4-year-olds that participate, they have to go through a brief training, but they get a tablet for their child, a free tablet, and they can keep it. They don't have to give it back. So, and it's one other possible way to engage, parents and children with one another. So if you're interested in Waterford Upstart, please put it in the chat, and I will make sure that you get that information. Tracy, I think, didn't you also post it on Child Care Aware?
I believe it went out, yes. Mhm.
Okay, all right, maybe that's more efficient. So go to Child Care Aware and look for the information for Waterford Upstart. I know at this moment they have spaces for 90 more 4-year-olds to be filled, and even after those are filled, then there's another funder willing to step up and fund more children participating. So if you're interested or your parents are interested, there's a really good chance that they could get into the program. Thank you.
Thank you, Deborah. We can start with the questions. Melissa, are you available to answer some now, or would you like me to send you them?
I'm here.
Okay. People are wondering what the turnaround for the waiver is for school-age children.
Knowing that's probably going to be a popular waiver, we're in the process of drafting a kind of a template response so that once we receive them, we'll just be turning them around and approving them and sending them out. So we do plan on doing it very quickly. We know that the concern's there, and we do plan on approving them. So like within probably 2 days, maybe, depending on, receiving it and sending it, but it'll be quick.
Okay. Thank you. Are we able to take children older than our license allows?
No, you would need to talk to your licensing coordinator and get your license revised. It's not really a revision at that point. We would just be revising the age on your license, which is a quicker process actually usually than a waiver. So reach out to your licensing coordinator or email our office and we'll get that process started.
Is this just for programs that are not licensed already for school age?
No, it's for everyone because how school age is defined as caring for school age children no more than 5 hours on their normal school days. So they're still going to be considered in school if it's even a remote situation or a hybrid situation. They're still considered enrolled in school. It's the way our statute is written. So anyone who is caring for school age children, and if those school age children will be in your care more than 5 hours a day, you will need to apply for that waiver.
Okay, and then the last one is, does the waiver for school age apply for half-day kindergarten? Most of my kindergartners are at the daycare more than 5 hours a day, but not all of them.
So that's a different situation because the definition in statute and rules says it's children enrolled in a full day school program. So if they're enrolled in a half-day kindergarten, then they would not be part of your school age license. They're part of your license known as group child care because they would still fall under that category and not school age. So it's only for children, full day school program.
Okay, thank you, Melissa.
You're welcome.
We did get a few questions for Patricia Tilley, but I will send those to her. The rest of them are all for Miss Diane Chase and Deborah Nelson. The first one that people are wondering is how they spend the money. Can you talk about the ways to invoice and where the invoices will be sent?
How you can spend the money, and the simple answer is it's on COVID-related expenses and losses. I know that feels like a really broad term, and that's why we're putting together this specific recorded webinar on just those points. But I do want to say, don't hesitate to reach out by email, and after you listen to that on Monday, if you have additional questions, reach out to us and ask, because we can help interpret some of those for you. For example, you might be asking, here's one that I was asked yesterday. I got an email that said, can we do playground improvements with with this money? And if you are doing your playground improvements that are part of your annual maintaining your playground, no, obviously that's something you would have to do anyway. But if you are doing your playground improvements and upgrades as a means to be able to have 2 classes out on the playground at the same time, yes, that is COVID related. So those are the kind of interpretations we can help you with. And we'll also address in that same webinar how you document those. You're not going to be sending in your receipts to us. This is part of you keeping track of your accounting information on site. In the event that the Fed will, the Fed or the state also do audits on those sort of things. They do checks and balances. And my gut feel is that with the amount of money that's being spread around the country, that there'll be a lot of checks and balances down the road. The other piece of that is that you will be reporting in your final report how those funds that you spent, how you spent them in a general sense, and how they impacted your program. So again, keeping track of those is valuable. Regarding the invoices, Emma, can you repeat that part of the question for me?
Basically, a couple people have asked, I think these are probably people who have not been sent their packets yet, but where are invoices coming from? Like, okay, how do they get our invoices?
Okay, so the sequence goes like this. You sent in your application, it was reviewed, you should have gotten an award letter. The award letter is based on your number of your children that you are licensed or approved for, not how many that you're serving right now, because we know that number is lower. And we're hoping, obviously, that things will get better and you'll be able to serve more children. And then, so you get that award letter. Attached to that was the blank agreement and attestation. If you're a multi-site program, you also should have gotten a Excel spreadsheet that has the breakdown of your individual programs. Once you complete those and fully complete them with your initials, write in your amount, make sure it's electronically signed. If you can't electronically sign it, you can sign them, initial each page with, and date it, and you send that back into the either to me and my address, or you can send it electronically. Once we get that and it's all complete, then we turn around and we'll send you an invoice packet that includes, depending on what kind of program you are, multi-site, individual, or summer program, we'll send you anywhere from 1 to 3 invoices with instructions, and you complete those electronically and you submit them. We sign off and say, yep, this is a legitimate program, and off it goes to finance. They will process that and cut you a check, which can take a week or so, week to 2 weeks, depending on the volume. You do have to have a vendor number that you get through the state. Go back to your award letter. The instructions are in there on how to, or the link to how to apply for that. And you must have, we can't process your invoice until we have that vendor number, and we don't control the vendor numbers.
Diane, would you mention about why 1 to 3 invoices?
Oh, yes. Because the way that it's staggered, we did this not only because we have programs that approached us and said, I'm not sure I'm going to need all this money, or I want to take all this money, as Deborah mentioned, due to tax liability. Also, we know that some programs might not be reopening. Things can happen and they might not reopen. So what we did is we structured for multi-site and single programs. We structured an invoice system that you get 60% on your invoice. 30 days later, you can put in an invoice for the balance, the 40%, or you can break that up and do a third invoice. So it depends on what it works for the finances for your program. One of the things to keep in mind with that too is that no matter how you structure it, you have to have billed us for all of that money that you're going to accept by October 30th. You still have till December 30th in terms of us getting it out the door and getting things spent, but you have to get an invoice in by that time. Summer programs, because you're very short, you've got what, 6 or 8 weeks left? On the other hand, summer may just go on forever. But we do know those are a one-shot invoice because you have a very short period of time. What else, Emma?
If you did not apply for this round, can you apply for second round of funding?
That's a very good question. And I don't know the answer to that. I apologize. We haven't addressed that, but I will, we'll talk to the team. We'll talk to our leadership and see what the answer is. I know that when we put these programs together, we had to go to the Gopher group and say, this is our plan, this is our pitch. And I'm not 100% sure if we factored that in. So I will, I'll follow up and we'll get an answer to that.
Should we submit a provider attestation even if the award amount is incorrect, or should we wait to hear from somebody on the ACCP team?
You should not. If it's incorrect, and let me just tell you some of the reasons that might be. We used the report from licensing, and they were terrific on telling us where people were on their licenses, but we know that some of those changed. They do not include, as I've discussed with folks, they don't include waivers. So if you had an increase because of a waiver, that wasn't factored in and won't be factored in. But also, and I'm the first one to admit, As you saw, many of your award letters came out over July 4th. That's what I was doing on July 4th. And I'm sure I typed in some of the numbers incorrectly. So what you should do is shoot us an email ASAP to the ECCP mailbox and say, there's a discrepancy, or I have a question. Sometimes it's just a clarification. You will get a revised award letter if there's going to be a change, and then you should submit your attestation. If you've already sent it in, your attestation and your agreement, and you feel like there's an error, that's not carved in stone. We can back up and fix that. So again, please send us the email. And please put in the subject, discrepancy in license numbers. And this is a silly thing to ask people to do, but you might not realize it. You all are wonderful about writing great emails, but if your email is diane@gmail.com, lots of times people forget to put their program name in there. So it takes us a while to figure out who you are. So if you can always make sure you put your program name in your email, that would be appreciated.
Thank you, Diane. People are wondering how long the ECCP designation is in effect for.
It ended on June, help me, it was June 1st, I think, whatever that Monday, June 1st, June Thursday, June 3rd, when the governor stated that we were open, it's for business. So the actual designation itself is no longer required to be an open childcare.
However, if I may add, we required it for our purposes because it was a way for us to track who, those that were receiving funds, who was open or not. So even though we would probably not call it an ECCP anymore, we need to have people designated in that way.
On invoice number 1, it says attach summary enrollment form. Is there a certain format that you need the enrollment information in?
That is only for multi-site programs, and that should be the Excel spreadsheet that I sent you when you got your award notification. And it should have, in some cases, many of the multi-sites, we've adjusted those, and it has a column that has a place for signatures. That's what you're going to attach. And I will, I'm working through the rest of the multi-site notification, or not notifications, but agreements and invoices, yeah, this afternoon, and I'll make sure I attach that again to those emails.
And then the last one before we wrap up is if I have school-aged children that get state assistance and will be with us all day during the school day, how will billing work for them?
I'm going to defer that to Deborah.
Could you please repeat the question? I was reading Marty. See, this is the distraction of the chat box. I was reading Marty's answer to one of the questions. So yeah. I'm sorry, Emma.
That's all right. It's if I have school-age children that get state assistance and will be with us all day during the school day, how will billing work for these children?
That's an excellent question. So here we are in uncharted waters again. And as you know, we actually opened up the full-time care for school-age children months earlier than normal because of COVID. And that typically, and then we had it run all the way through, I believe, September 8th is the last day. And then, in typical times, it would go back to normal billing for, not in school time. Because of the situation, we need to look at all of our options. We need to look at the budget because that's an expensive policy that we had put in place. And we have to see what funds we have available to support it. So stay tuned. We are aware. We're going to be also having conversations with the Department of Ed if they have any plans to help support families through because of the staggered times or needing to be in care more hours. So we don't yet have an answer, but we're working on it, and we'll see what we can do as quickly as we can. I know the other thing we're going to be doing is exploring, and this is not for childcare enrolled with us, but, you know, like neighborhood co-ops, and, you know, do families have other options to be able to support each other through when their children are not in school, but they need to work. So, and if anybody has any ideas or thoughts, please send us, put comments in the chat box, and we will consider.
And if I can just add on to that, one of the questions that I've gotten quite a bit is, what if the schools don't open, or what if the schools are closed and my operation out of the schools? And having been a former after-school program coordinator for the Austin, Texas school district, we experienced that during some of our severe weather situations where schools were damaged. I have a sort of a multi-phase to that, which is one, we want to help you find alternative sites. We're actively working on bolstering your local coalitions, your local groups to get together and help you find alternative sites. For example, my experience was we used churches, we had companies that gave us their cafeterias. So we may have to be clever for some of those, even if you have a school age program where the school isn't going to let you run the after school program. Let's start talking about those now, and have a backup plan. The second thing is, you already lost money. So if you were an after school program, you were shut down in, and this money runs March 1st is the period that you can count expenses. So it's from when things were shut down in, I don't remember when they really closed schools. I guess that was the middle of March. It feels like forever ago. And you may have had a summer program as well that you were not able to do. So those losses can come out of these funds. So again, that's a place where we can help you figure out, you already spent some of your award money without even knowing it. So it is obviously our hope that you reopen. It's our hope that you can use it towards the new school year. But don't be afraid to take the funds if you're not, just because you're unsure of whether you're going to be open at this point. We'll help you walk that through. And I think that's it for mine.
Questions.
Great.
Okay. So thank you to all of our speakers today. Special thanks to the providers who provided us with questions for public health. It's appreciated. To close, we'd like to remind you to complete the session evaluation survey. This was included in your initial registration email for this webinar. This recording will be posted on the www.nh.childcareware.org website under a page entitled Recovery and Stabilization under our COVID-19 tab. This page will be populated and up within 1 business day. A reminder, professional development hours will be provided to all those participants registered in the New Hampshire Professional Registry for an hour of training time. As a reminder, if you haven't already done so, please put your first name, last name, and your child care program in the chat feature. We'll be marking your training transcript complete within 2 business days. If you are on the webinar and are not an early childhood provider and are not within the New Hampshire Professional Registry, you can request documentation of your participation by emailing Donna Lake at ccrrtraining@snhs.org. For those of you who are viewing the recording of this webinar, please use the self-study sheet at the top of the training and webinar page on the Child Care Aware of New Hampshire website. As I indicated earlier, these webinars are being conducted every other week on Thursdays, beginning at 12:30 p.m. through to August 20th. Registration information for the webinar series is available through the New Hampshire Professional Registry, and a flyer regarding the series is posted on the Child Care Aware of New Hampshire website on the front page slider. Our next session is being provided on August 6th from 12:30 to 1:30. Will be moderated by Marty Ilg, as Child Care Aware of New Hampshire will be conducting our annual retreat, 6 feet apart. Thank you, Marty, for moderating. Registration is available for all sessions now. So just some parting thoughts. I just kind of like to share some experiences I've had. And this week I was able to actually venture out and drop off some environment rating scale books to 2 programs in Keene. And they're participating in our ERS virtual TA cohort. While there, I was able to see families either bringing their children into a program or picking them up. and I saw one little guy who was skipping with his mom with a small little face mask on as he was headed toward the doors of the program from his family's car. And I was kind of struck by how normal it seemed now and how he was so contently happy getting to his next destination. When I was asked at one of the programs I visited why I was out in Keene, I was struck again when the director seemed surprised that I had come out to Keene to drop off the books and to see her. It was pretty simple. Of course, I'd drive over and do that. I'm kind of tired of working from home and staring at Zoom faces, so I kind of wanted some real ones and you know, like hers. But it was also cool to hear from one of the executive directors of one of the programs how she was excited to see the new ERS 3 edition, and that she at one point in time had worked with the tool. Additionally, she also worked at a child care resource and referral program in Vermont. And I guess my parting thoughts are, I don't know about you, but I miss real live people and the connections that we all have together in some way and in some fashion. And even though we are now working remotely through these webinars, we are still able to have some sense of connection. So as we leave you this afternoon, we hope this webinar session leaves you feeling more connected and feeling more up to date. In addition, we hope our upcoming sessions will enable you to obtain the information and resources you need to continue the wonderful work you do to support families, children, and the state of New Hampshire. We hope you enjoy the next few weeks of summer. August is coming really quick. Be safe and well. And thank you for your time and interest today, and enjoy the remainder of your afternoon. Thank you.